Managing a general surgery practice involves juggling patient care, tight schedules, and a volume of operational paperwork that never seems to shrink. Billing for these procedures is a different level of complexity compared to a routine office visit. You are navigating surgical CPT codes, strict modifier rules, and payer-specific bundling restrictions that change without notice. This chart shows initial claim denial rates reaching 11.8% in 2024, up from 10.2%. Beyond the billing itself, practices must manage the growing administrative hurdle of surgical prior authorizations. On average, a medical practice now handles 39 prior authorizations per physician every single week. This workload forces staff to spend roughly 13 hours per week purely on authorization paperwork and clinical follow-ups. These inefficiencies lead to a massive drain on the system, with annual revenue losses estimated between $23 billion and $31 billion across U.S. healthcare. When in-house teams fall behind, the penalty is often permanent. Shorter payer appeal windows mean that missing a deadline on a wrongful denial turns a temporary delay into a total loss. This chart illustrates the increasing cost of administrative errors. In 2022, the average cost to rework a single denied claim was roughly $44. By 2023, that cost rose to $57.23. Between the lost payment and the labor required to refile it, every denied claim creates a direct hole in your practice's operating budget. While payer rules create the friction, the consistency of your collections often comes down to the stability of your billing desk. Many practices find themselves in a training spiral, hiring a new biller, spending weeks training them on specific surgery codes and contracts, and then losing them to another organization. MGMA data shows a 33.3% turnover rate for business operations support staff, including those in billing roles. When a specialist leaves, the practice suffers a period of reduced billing accuracy and higher denial rates, while a new hire attempts to catch up. The cost of maintaining this in-house role is significant, with base salaries for medical billing specialists typically ranging from $55,000 to $70,000 per year. As this waterfall chart shows, when you include benefits, employer taxes, and training, the fully burdened cost of one billing employee often reaches $65,000 to $80,000. This investment is at risk every time an operative note lacks a specific diagnosis linkage or a bundling rule is applied incorrectly, triggering an expensive denial. Relying on a rotating cast of generalist staff creates a high-cost model that lacks the specific expertise needed to navigate complex surgical claims. High turnover also contributes to a lack of clear operational visibility. Many in-house teams provide basic monthly collections reports, but they lack the granular data needed to manage a practice, first-pass resolution rates, and days in AR by payer. Waiting for monthly reports makes it impossible to react quickly when a payer changes a policy or a new denial trend emerges. Without data tracking individual CPT codes, staff cannot identify the root cause of failures, leaving the practice to react to denials rather than preventing them. Surgical billing policies evolve constantly. Staying compliant requires continuous training to ensure billers know current payer requirements before they hit submit. Without deep specialty credentials and proactive data tracking, a practice remains in a cycle of working denials after the revenue has already been delayed. One strategic alternative is moving away from a generalist staffing model in favor of a specialized revenue cycle management partner. This involves using AAPC and AHIMA-credentialed specialists who focus exclusively on the specific codes and modifiers used in general surgery. These dedicated teams work natively inside your practice's own EMR, giving them full access to the same systems your staff uses every day. Staffingly, Inc. provides this exact model, currently supporting over 800 practices across the United States. This matrix shows the financial shift. An in-house FTE can cost $75,000 annually, while Staffingly's model is roughly $20,000. This removes secondary expenses. Your practice eliminates benefits costs, training overhead, and the financial risk of turnover. Practice managers can trade the high cost and disruption of in-house staffing for a lower-cost model that provides guaranteed surgical billing expertise. This specialized approach utilizes AI-augmented routing to ensure complex claims reach the specialist with the most relevant expertise. Predictive workload management keeps throughput consistent, ensuring claims are processed quickly even during high surgical volume. Automated pre-submission audits identify errors before the claim goes out, which is significantly more cost-effective than managing a denial later. Managing these automated checks, Staffingly maintained error rates below 1% across its client base. Integration is designed for speed, with most practices completing onboarding and going live in as little as 14 days. This onboarding includes a 14-day risk-free pilot, allowing the team to train on your specific protocols and payer mix before you commit to a monthly engagement. Security is managed under SOC 2 Type 2 and HIT Trust frameworks, and the practice receives weekly KPI reports that provide clear visibility into accuracy and turnaround times.